Good evening, viewers, and I welcome you to this Facebook Live session on myths and facts about spinal surgery. To talk more about this session, we have with us Dr. Tarush Rustagi, consultant spine surgeon at Indian Spinal Injury Centers, New Delhi. Dr. Rustagi has done spinal fellowships from India, Sweden, as well as USA, and his areas of special interest are spinal deformities and spinal tumors. In addition, Dr. Rustagi has more than 85 publications in various peer-reviewed journals. Dr. Rustagi, we welcome you to this session on spinal myths and facts about spinal surgeries and would request you to take our audience through your talk. Over to you, sir.
So thank you very much, first of all, for a very kind and generous introduction. So just allow me to share the screen. It is going to be a very short sort of presentation, and I'll be more than happy to take questions and comments at the end. So we'll be talking about some of the myths and facts about spine and spinal surgery in general. Why it is important? Because there are a lot of misconceptions and a lot of misinformation that is there in our community, in our society, amongst patients, that spine problems are permanent and spinal surgeries are really unsafe. So we will just take a few myths that are there in our viewers and hope to shed them one by one. So what is a myth? Myth is basically any traditional story, which is concerning in some early history of some phenomena that typically involves the society in general and some events that happen. So basically, we all have grown up looking at mythology, and then we come across certain evidence and certain examples which make us feel that no, this is not a myth. It is actually could be a reality. So what is important? The key is the evidence. Now, it is obviously a mystery or it's a myth until something is proven. And especially in spinal disorders and spinal surgery, we have so much evidence, we have so much practical awareness and knowledge that most of the misconceptions and the myths that were associated with spine surgery can now be shed in modern times. Why, especially in spinal surgery and spinal issue, there are a lot of misconceptions because of quite a lot of factors. Some of them are like lack of communication, where the surgeons actually fail to communicate effectively with the patient as to what is a spinal disorder and what sort of spine surgery they are discussing about. Lack of publication, we are not publishing enough, or we are not addressing the problems very effectively. Lack of awareness in the society, false belief. We always have some relative or some acquaintance who have had a bad experience with some particular surgery, and then it percolates in the society, percolates in the family so deeply that everyone is so scared about even thinking about spinal disorders and spinal surgery. Same thing with hearsay. We hear about bad things happening. We always like to hear what the bad things. We forget about the good things that happen to the patient. But obviously, there is vast disparity in India. There are rural settings, rural urban settings, urban settings, and so the amount of information that goes in these cities and towns is much different than what we may be seeing in some of the urban cities. So some misconceptions like gaining weight does not matter. I mean, we see patients coming to the clinic with a huge belly and they think that they're having back pain. And when you tell them you need to lose weight, they are really surprised at how it is related to back pain. Well, it is definitely related to back pain. When you gain weight, then your center of gravity or your posture actually tends to fall forward. That causes a tremendous amount of stress on your muscles, the disc, the joints, the ligaments. And it is because of increased wear and tear that there is increased incidence of back pain. So lose weight if you want to keep your back healthy. Similarly, there is a very common misconception or a myth that you can wear a brace in order to improve your posture, while it is absolutely untrue. While brace is useful in certain conditions, in most of the spinal conditions, you actually do not need a brace. The more you use an artificial support or a brace, the more you are going to not use your muscles, causing further atrophy or disuse of the muscles, causing a cycle of back pain that keeps on evolving over time. So about spine surgery, when you go to a surgeon, the myth is the surgeon is always going to say surgery. Well, that is absolutely not true. Surgery is not for everyone. Only when you absolutely need surgery, a surgery is indicated. And there are always multiple treatment options that are available apart from surgery. Everything has to be tried first before contemplating surgery, unless, of course, it is an emergency. In a regular OPD practice, at least in my OPD practice, less than 5% of the patients, of all the spine patients that I see in the OPD, may be surgical. 95 patients out of 100 do not need any surgical surgery or any discussion about surgery at all. What is important is that it is important to discuss the treatment options with the patient so that they are able to make a decision rather than the doctor making a decision for themselves. Spine surgery, you are paralyzed. This is a very, very common, myth that if you have a spine surgery, you are going to be paralyzed. This is absolutely not true. Spine surgery is meant to prevent paralysis, not to cause paralysis. Yes, complications can happen with anything, any procedure, not just spine surgery, but the incidence of major complications happening is not less than, it's not more than 1%, less than 1%, which is really low. So another myth is after spine surgery that there's always going to be pain in the back. Well, spine, of course, is a large part of the body. In their entire upper, the torso or the middle part is covered, is your spine. So there's bound to be some pain after surgery, which is taken care by a good team of doctors to control your pain. But what is important is that the pain after spine surgery keeps on getting better. And that is why it is so important to discuss with your doctor, discuss with your surgeon about what is going to happen after surgery, how the pain is going to be. It is also important to engage the patient to maintain proper posture, take certain precautions, and to exercise. Another myth is that if you have a spine surgery, then you are always on bed rest. The recovery does not happen. Yes, of course, it hurts when you fall, but it hurts for a few days. Similarly, when you have a surgery, it hurts for some time, but the pain keeps on getting better as time goes. And it depends on a lot of factors. What is your age? What type of spine surgery you are having? And your overall health status is also very important. For example, in certain surgeries like anterior neck surgeries, on the front side neck surgeries, in discectomies or in small decompression, the recovery period is just a few weeks, not more than that. And in any bigger surgeries, it can be a few months. But as I said, that the pain actually or the recovery keeps on improving, or the recovery basically, the patient keeps on getting better with time. And as I said before, it is important to talk to the doctor, and the doctor talks to the patient about what they should expect in terms of recovery after spine surgery. Another is that after spinal surgery, the movements will be restricted, or there will be restriction of movement throughout the life. Well, again, as before, it is just a myth. The aim of any surgery, not just spine surgery, is to return to the pre-problem quality of life as much as possible. So that is very important for us surgeons, that the patient are able to go back to what they were doing before surgery as much as possible. But again, it depends on what condition you have, what sort of surgery you have, what sort of nerve problems you have, what sort of paralysis you have. So there are a lot of things that can come into the picture. In most of the cases, I would say at least in more than 90% of the spinal surgery cases, there are no major restrictions, and except to take certain precautions, except to do certain things in the right way. But as far as the restriction is concerned, in most of the cases, there are no major restrictions after spinal surgery. Another is I'm too old or I'm too young to have spine surgery. Yes, of course, the age matters. But what is important is you are having a problem right now, and you are not going to age backwards. So, of course, as the age increases, it is a risk factor for surgery. That's why it is so important to do a proper evaluation, medical evaluation, proper optimization of the patient before undergoing surgery. And it is also important to discuss these risk factors with the surgeon, with the anesthetist, with the physician, and then weigh the bad and the good about surgery, and then to move forward. And as I said, if you have a strong surgical indication, the best time to have surgery is now, because you are not going to age backward. Another is spine surgery is never successful. This is very common that we hear in day-to-day, OPD practice is that the spine surgery is not going to be successful. The complications can happen, as I said, but as I said before, the major complications are less than 1%. It is important to have a preoperative workup, proper optimization of the patient. It is not just the patient and the surgeon who is involved in surgery. There are a lot of other doctors who are involved, including anesthetist, physician, cardiologist, pain team. So everyone is important in managing the patient. And with a realistic expectation and a shared decision making, there is every reason to expect a successful surgery. So what is the conclusion? If we can have these 5 rightly placed, I think everything should be okay. Have the right patient, the right indication for surgery, doing the surgery at the right time, with the right workup and the right surgery, the outcome is usually pretty good. So thank you. I thank the organizers and thank the listeners for their patient listening. And I'll be more than happy to take any questions or comments. I'll stop sharing the screen, and then we'll take it forward.
Thank you, sir. Thank you for a very, I would say, very simple but very effective presentation. I think most of the questions that people have been covered. I think the foremost risk when people think of spine surgery is, and as you said, mentioned in the first slide, is hearsay, which is people talk a lot about paralysis ho jayega, ye hoga. And I think you said it is less than 1% of cases where you see serious complications. So that is one part. Sir, the question is, nowadays we hear a lot about minimally invasive surgery. So I mean, what is it and how is it different from is it different from the traditional surgery? I mean, and does it apply to spine surgery also? And I mean, if what are the benefits of it? So if you can just elaborate slightly more on that, that would be helpful.
So that's a very good question. So minimally invasive spine surgery, which we also do, is a type of surgery itself. Now, to say whether the complications or the risk of minimally invasive spine surgery are any different from in open surgery, it's probably not correct, because the outcome and everything is more or less the same if we look at the long term. So if you look at a patient now, you do a minimally invasive surgery and you do an open surgery, after say 3 months, the outcome is going to be the same. But yes, with minimally invasive spine surgery, the immediate post-operative pain is definitely less. But this is something that has to be discussed with the patient, whether the indication for surgery is right to do a minimally invasive surgery or not. Because doing a minimally invasive surgery, which required a different form of surgery, is also not the right way of doing things. So yes, minimally invasive surgery has a lot of role in today's world, and we do it quite often. But again, it has to be discussed with the patient and the family in detail about what surgical approach you are thinking.
Sir, the second question that you got is, sir, you mentioned that gaining weight is also one of the risk factors, which hurts your spine. So, apart from that, I mean, any specific factors that you see in your patients, I mean, which people can, work upon so that damage to spine can be prevented? And
yeah, so correct. So there are a lot of actually factors which can impact your spine health. Gaining weight is one of them. I touched upon one of them because this was a relatively short presentation. But there are a lot of lifestyle changes that need to be incorporated or corrected in our day-to-day life, that include sitting for long hours at a stretch, gaining weight, not doing any exercises, having an improper posture, especially in our day-to-day urban lifestyle where we tend to sit for long hours at a stretch. That is something that is extremely harmful for the back. Not doing any exercises, using, for example, mobile phones, or you sitting on the laptop for long hours can put a lot of strain on your neck. And that can also is one of the very important causes of neck pain, also called as a neck syndrome. And similarly, exercise is something that is very important. Walking as much as possible, taking a flight of stairs instead of using an elevator are some of the very small things, but very critical. So these are all additive things. So if you do the right things, every day for a long period of time, they will give you a very good outcome to prevent issues related to your back and neck in your life.
Okay. Uh, Certainly, other common thing which is seen in youngsters, it is they have a lot of back pain, which is accompanied by sort of radiating pain in the lower half of the body. So, I mean, are the risk factors what you mentioned, are they the same, or there is any specific risk factors to it which leads to such a condition?
Yeah, I mean, back pain in young radiating to the back can be related to a spinal problem, but there is also a chance that the radiating pain to the lower extremity or to the legs may not be from the spinal problem. All the risk factors, all the lifestyle issues that we discussed some time back are obviously related to having the leg pain. But apart from that, any sports injury or any gym activity or gymming injury like lifting heavy weight or unaccustomed injury to the back, road traffic accident, all these things can also be associated with a disc injury that can cause a herniation or a slip disc in the back. So that can also be a cause of that thing.
And sir, one last question that we have received is, you mentioned about the risk factors and what to be taken. So, I mean, sir, is there any such recommendation for a diet? So is diet also can lead to I mean, or responsible for either ways? Can it affect your spine health?
Yeah. So that's a very interesting question because diet is obviously a very important component of getting the appropriate nutrition for our body in general. That includes the spine. So healthy diet, with a lot of proteins and minerals and vitamins is important. But what is important is that the diet has to be balanced with the lifestyle that you are having. So, for example, if it is a farmer who is is working in the field for long hours, he definitely needs a very high protein and high carbohydrate diet. But for an urban person who is sitting in an office, not consuming much of energy, he does not need so much of rich diet, so as to say. But the modern diet containing a lot of fats and carbohydrates is something that has to be avoided in general, because that not only affects the general health but also affects the spine. And one more important component that also comes in the domain of lifestyle is smoking. Smoking is something that has been uh, proven very categorically with having disc problems and spinal problems. So smoking or use of tobacco in any form, be it tambaku, be it gutta, any form, is known to cause issues related to spine. So that is something that I tell all my patients, that you have to quit smoking. There is no cutting down on smoking. You have to quit smoking.
So yes, sir, that's all. Those are the questions that we have. So thank you once again, sir, for discussing this topic in a very simplified way, and I'm sure the audience would have benefited at large. And a lot of myths about spine surgery, I'm sure, has been resolved. So thank you, sir, once again for a wonderful session.
So it was my extreme pleasure, and again, thank you to your team for getting it done. I really hope that at least we were able to get the message across to our viewers. Thank you.
Thank you.